Okay, so we are from Phillips County Health Systems, and we were their 2024 interns.
So my name is Makenna. I am a sophomore at Bethany College. I'm a pre-med major, so being at the hospital was really beneficial for me. And so after I get my bachelor's, I want to go to medical school at KU. And so being able to shadow MDs or the physicians at the clinic was really helpful because I get to have insight on their journey, on how they got their degrees, because there's multiple different ways to get to become a physician. You can either go your MD or your DO. So just figuring out the best way for me to get that degree was really helpful, and being able to find programs that I could help jumpstart my career was really helpful too. And I was able to make connections and have references for my future for when I want to apply for those programs, which was really helpful. And so in the clinic, I basically just followed around. Towards the end of it, I was able to do more things because it's a little difficult in hospital settings because we don't have every single license. So it may be a little difficult to do things, but I was able to follow in on most patients and ask questions for the physicians afterwards.
So my name's Jaelyn Miller. I kind of understudied in the rehab center for physical therapy. I am a sophomore at Cloud Community College. I'm studying pre-physical therapy and hoping, I don't know where I'm going after quite yet. I'm still trying to settle. But currently, at the time, I was a little nervous for it for sure because, like Makenna said, it is kind of hard to do certain things because you don't have the proper licenses for it. But a lot of the stuff that I did was cleaning beds, kind of making sure that everything's set up for the patients. I also was a lot more hands-on with like wound care. I was able to help give them their supplies, which was really like my favorite part. So I kind of learned how much I enjoy wound care, which might drive me more to be more practiced in that area. I also learned several different things that I didn't completely know that physical therapists do, and I also learned that it is something that I'm definitely going to strive for down my path.
And then my name's Brock Burrish. I'm going to be a junior at Hastings College in Hastings, Nebraska, and I kind of did the same thing as Jaelyn. We kind of flip-flopped days and worked opposites, so we did a lot of the same things, preparing rooms, getting things that any PT or PTA needed, OT help. And then the best part was definitely the wound care. You could be a lot more hands-on. We got to see a lot of different things, from big blown up big toes that have all sorts of debridement need and stuff like that, to just normal huge cuts on their leg from a car door. So that part was really fun. And then a lot of the good stuff that came from it was just being able to talk to the physical therapists there at Phillipsburg. They gave us a lot of useful information on applying for school, going to different places, and then just keeping track of everything you may need in the next couple years and down the road.
My name is Addison Green Russell, and I will be a senior this year at Lakeside High School. And this summer, I got to utilize a really neat rotational type of internship. So going into this, I knew I wanted to be in healthcare, but I really didn't know where I needed to be. I thought that I had probably a focus in nursing, and that was definitely strengthened this summer. I was kind of all over the hospital and the clinic, so I was in the clinic, in the OR, in the ER. I was in outpatient clinic, so I got to see a lot of really neat different specialties. I saw cardiology, podiatry, which is something that I definitely found I do not want to go into. I'm not a fan of feet. In addition to that, I had a lot of really neat experiences shadowing people, and they gave me a lot of helpful tips and tricks to further me and my experience, and also some advice when I start thinking about where I'm going to apply and kind of the path that I should follow for certain things. I learned a lot this summer, and one experience that kind of was pivotal, I guess, for me is I was working with the cardiologist, and I put the stethoscope on wrong. which is not something that you think about, and I'm a CNA, and that was not something that was taught to me in my CNA course. And I felt really silly, and I was super, super embarrassed. But then I got to thinking, like, if she wouldn't have told me, then I maybe not would have known that I would have been doing it wrong, and I could have done it wrong that many more times. So that was something that kind of helped me to realize that I really needed to dive in and learn everything I could and not be embarrassed to ask questions that I thought were stupid, because a lot of them weren't. And they were really beneficial to me this summer. So here are some pictures from our internship, and obviously working at the hospital, you do have to be a little bit cautious about what pictures you're taking and what's in them. So some of these are reenactments that all of us interns got to do, but we just reenacted them with each other because we couldn't have patients in our pictures. So in the upper right-hand corner, that is me taking vitals on Brock. Thank you for being the guinea pig for these pictures. And I spent a lot of my summer taking vitals in the clinic and an outpatient clinic. In addition to that, I took breath sounds, which you can see me doing with Jaelyn. And I learned how to take eye exams. When the summer started to close, we did a lot of school sports physicals, and so I got to learn how to record the height and weight on charts, and in addition to that, doing the eye exam. So that was really neat for me. Makenna, do you want to talk about nuke med?
Yeah. So Addie and I both were able to follow around in nuclear medicine. So that is just stress tests for cardiology, for looking at the heart. So it'll be this picture up here. And so basically we tested the heart when it was resting and then when it was stressed. So we injected the patient with a certain medicine that's actually really cool. It basically speeds up your heart rate and makes you feel like you're exercising when you're really just laying in your bed. And so it was really neat to see the patient's reaction, because she was getting short of breath, like she was actually exercising, but she really wasn't doing anything. And so her heart was completely fine, but this patient that the nuke med physician showed us is a bad heart. So I know it's really hard to see, but right here, this is a regular heart on top of a stressed heart. And so usually this whole area would look the same, but this little area that's gridded out would be the bad heart. So your heart isn't reacting the same under stress. And so having that grid space, and especially that much of it, is not good. And so it's really neat to be able to see that and see the comparison between a healthy and good heart versus a not healthy heart.
Then the one picture up there is me grabbing a hot pack for a patient that needed it. And then the other thing I was going to talk about is we obviously couldn't take pictures, but Makenna and I got to watch a swallow study test in the radiology department, which was really cool. A gentleman was struggling swallowing his food and needed some assistance and diet change, so we got to actually watch them go through the process of testing for that and how their big machine works in the radiology department.
Up there in the right corner, you guys can see that I'm tossing it back. Obviously, that's not a patient. That is one of the front desk ladies named Sandy. She was a big mentor for me. She also helps kind of do what I did. Like when us interns aren't there, she does a lot of the stuff that we do. And she definitely showed me how you can have so much on your plate and be a positive person for sure. She also showed me the ropes around the front desk. I did spend a day at the front desk because both of the ladies were gone, which kind of put me in a full spin moment. I didn't realize how much those ladies do up there. But I got to watch the scheduling and answer phone calls and how to talk. I think customer service is definitely a big thing that I learned, and just, common courtesy. I got to learn different parts of new people, and they were very good at keeping us hands-on and not just sitting there, withering away. But I really enjoyed the whole experience.
So throughout the summer, we did have several big projects, and we're each going to take a turn talking about what those projects were.
So one of our first projects we did was make t-shirts for the hospital. And so basically we made these t-shirts, and the back of it, one of you want to spin around? Your hair's covering it. It's Small Town Big Heart, which was really nice because small town community, just showing the connection that the hospital has for patients and patient care connection is really important. But we had a lot of fun designing these because interns design it every single year. And yeah, that was one of the first projects that we did.
Our most recent one coming up with KBR is decorating hay bales. There's a couple pictures down there in the left-hand corner. Really, it was just it was a nice way for us to get involved with our departments around the hospital and actually get to talk to them and see some stuff like that around. And Jaelyn and I made a minion-looking hay bale, and Makenna and Addison did a nice little bear and chart on theirs. So if you want to take a peek at those, they're out front of the hospital and the clinic.
Another project we did was the farmers market. The Phillips County Health Systems, they all, every year, every farmers market, they kind of set up a station to help kind of educate the youth. And also, I think a lot of it was about diet this year. I know that they had like cornhole with like the plastic vegetables that you see in the toy room. Just, to show kids like, eating healthy can be fun if you're playing with vegetables that are good for you, you know what I mean? But they just kind of, spread the word about being healthy and definitely educating the youth.
And then the other thing that we did several smaller projects throughout the summer that maybe didn't have a name, but just kind of filling in where people needed us was really important. Whether that was grabbing fruit snacks from Dollar General for prizes, or maybe doing I know that I built some of the yard decor to put outside patient rooms just to kind of brighten the place up and make it really enjoyable for our patients. Obviously, nobody wants to be in the hospital, but making that the best experience that we can is really important to PCHS. So we had 3 big takeaways this summer, and I would say that the one I'm going to talk about is that a smile matters. So smiles are infectious, and in a hospital, it's really important that you smile at everyone. I can't tell you the amount of times that I walked through the hallway and saw a smile, whether that was from people that were working there or just community members, but it definitely helps the atmosphere, and I think it really also helps like our patients and just the general community.
And the many avenues, like I kind of said before, it could be different for everybody else, but I definitely found a lot of mentors and people who can be references for me with the doctors and physicians in the hospital. And so it was really cool to kind of just talk with them and pick their ear about certain medical things. And I know that in Phillips County especially, we are in very short staff of OBs. And when I first came in, I wanted to be an OB. And now I'm thinking a little bit more towards family medicine, so I can still do it all, but still provide the OB care that Phillips County really needs. Because we can provide prenatal care and everything like that, but when it's actually time to deliver, we have to go to Smith Center or Hayes, somewhere like that. And for some patients, that's kind of hard to travel. And so being able to provide that care, I was talking with a physician who does that right now, and that's kind of what made me decide to possibly do that.
And then our last one was just be available. A lot of our internship was basically helping out in any way we could, so just to be available to help and make the doctors, PT, OTs, anything that we could do to help them out to make their day run smoother.
So we talked a lot about at Leadership Days serving our communities, especially in our smaller communities. It's really important that we support each other and serve. And so I think that Phillips County Health Systems is one of the perfect places to do this. Obviously, we're there to help people. And so that was an easy lesson to learn, I think, for all of us this summer. And in addition to that, I think that a lot of young adults our age can definitely kind of concur with like a dual support. So the community has watched us grow up and kind of grow into who we are, and now it's our turn to give back to them and serve them in any way we can. And like I said, working at PCHS was just a really good opportunity to do that for the community. And that's all we have. Does anyone have any questions?
This whole time I've been trying to come up with a question over